As everyone can attest, life can be stressful. A popular herbal remedy is being used for some relief. It is called ashwagandha.
Here to talk about the potential benefits, side effects, safety concerns, basically everything you need to know is our 9 News medical expert, Dr. Pyle Coley. So what is ashwagandha? Because I've heard about it. I know how to pronounce it, but I don't know what the heck it is. Why is it so popular right now?
It's 3,000 years old, ladies. Oh. It's a medicinal herb from India. It stems from Ayurvedic medicine. And the name stands for ashwa is horse, gandha is smell. And so it's
horse smell?
Because it smells like a horse, but it's also thought to give you vitality like a horse. Oh. And so it comes from ancient India. Why do you think a 3,000-year-old medicine is now popular? Because of social media. So all the influencers are really looking towards this kind of more holistic approach where people are saying, I don't want medicines, I'd rather take supplements, I'd rather take something natural. So this herbal remedy has really kind of bubbled up to the surface. A lot of my patients are coming in on ashwagandha, wanting to take it for stress or for sleep.
So does it work? Are there any benefits? Have you, I'm sure there's studies, maybe not, because it is natural?
Yes, there are many studies, in fact. So it's what's called an adaptogen, which helps our body adapt to stress. So if you think about what happens when we have a stressful situation, our brain, which is the control center of stress, triggers a response, stress response mediated by hormones usually like cortisol. Ashwagandha can actually lower your levels of cortisol. So it mediates that axis. It also has antioxidant effects. Given to men, it can raise testosterone levels as well. That's where the vitality comes from. But the strongest evidence is really in anxiety. In fact, it's written into the anxiety guidelines to use it as an adjunctive therapy. And then also for sleep. The rest of the stuff, very weak evidence. Even in anxiety and sleep, it's sort of borderline evidence. I wouldn't hang my hat on it, but it does have some benefit.
I think I'll try it.
Well, yeah, 'cause some of those little tonics that I drink when I'm trying not to drink a glass of wine to go to sleep. I'll drink one of those like goofy tonics you find at Sprouts or whatever, and it has ashwagandha in it. Does it do anything? I don't know, but should I be concerned about any sort of side effects?
So it can upset your stomach, Alex. You have to be careful about GI side effects, nausea, and stomach upset. Anyone who has liver disease could have a fatal reaction to it. In fact, you can even have a fatal reaction if you don't have liver disease. So you have to be careful about the dose and the frequency with which you use this. Certainly shouldn't use it if you're pregnant at all, if you have any autoimmune conditions, and then certain medications for blood pressure, thyroid can interact with ashwagandha. So I wouldn't mind a tonic occasionally here or there, because the way that it was used in Ayurvedic Indian medicine was as a tonic. You mix it into cow's milk, you drink it warm cow's milk, ashwagandha right before bed, once in a while. So here there's also dose-dependent response. You don't want to be drinking it every single day. You don't want to be taking a pill every single day. We haven't really studied the safety of it for longer than 3 months at a time.
So if you had someone come in and say, listen, Dr. Coley, it does work for me, or they believe it is, what would the dosing, what would you tell them? How much should somebody take, and does it depend on that person?
So the highest dose you can take is 600 milligrams. That's the highest that's ever been studied. So it's important to look how much is in your tonic. 125 is better. Less is better. More can cause more of the side effects. I would monitor their liver function tests very carefully, because that's the reaction that it can really cause, is that problem with liver function. And I would say if you're taking it for energy and vitality and focus, which it helps with muscle recovery and tissue recovery, then you take it in the morning. If you're taking it for sleep, anxiety, or kind of winding down, then you can take it at night. No longer than 3 months. And again, make sure if you are going to take it, you have the pharmacist check all your medications so that there's no interaction. So you can dabble in ashwagandha, but I don't want you guys taking it every single day all the time and getting used to it, because it really hasn't been studied like that.
Okay, that's fair. A little here, a little there. At least you didn't poo-poo it like normal. Dr. Coley, thank you.